EMDR, I get very excited when I talk about it. It stands for Eye Movement Desensitization and Reprocessing. And what it is it is a psychotherapeutic approach to both health and pathology. It's a fabulous form of treatment. It has 8 phases, and it looks at the past events that drive your present behavior, and then it looks at the future and how you're going to behave better when you're done with therapy.
EMDR allows us to process the negative beliefs that we have internalized as a result of some situation or event in our life. And through EMDR, it allows us to process those memories and make them less traumatic.
EMDR takes that biologically stored memory out of long-term memory, puts it in working memory, brings it up now with all the components of the memory, which are the sensory components. Like, let's say I'm a Vietnam veteran and I cringe when I see a helicopter right now. Well, absolutely appropriate 40 years ago. But that memory hasn't been parked with a beginning, middle, and end in the past. So that triggers it, brings it into the present. We move the eyes back and forth. Your arousal goes down. You're not so scared. You're looking out at the therapist. And you're able to connect to the belief of, oh, I am safe now. And the memory goes back into your long-term memory, but reconsolidated and different. And you know, oh, I'm safe now, and you know that.
One of the things to understand about EMDR is that it is a complete treatment process, not just simply the eye movement. It starts out with establishing the relationship with the therapist and the client. And then beyond that is an understanding of what the process in itself will be about, what it will be like, so that there's a level of comfort with the client. All of this happens prior to actually the eye movement part, for which the name implies.
And that is where we do something like move your eyes back and forth and follow my fingers, which seems a little odd. But what it does is it taps into a natural occurring healing process of REM sleep that happens during the night. Then we move to installing your positive belief about yourself. The body often is the last to clear in an event. We do what's called a body scan, and then we close down the session and help the person prepare for their life in between visits with the therapist.
So some of the things that I've addressed utilizing EMDR are things like a fear of flying or a fear of driving on the freeway. These are things that can be addressed in EMDR and often are the result of some type of traumatic event or some type of underlying belief that something bad is going to happen to them.
If they have behavioral symptoms such as alcoholism, if they have emotional difficulties such as anxiety or depression, or anything that they're not happy with, relationship problems. I had a client come in after the Route 91 Las Vegas shooting. That client came in to me and we did a comprehensive treatment plan looking at that event, the things that are triggering her in the present, such as being at a crowd at her son's football game. That triggered being in a crowd back at the concert when she was shot at. Also going over the bots in the freeway, who to think about it, when you go over those bumps, when you're changing lanes, they go pop, 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 pop. That would trigger her, so she didn't even want to drive. And she actually sent me a text, which is what makes EMDR such a wonderful therapy, is that she said, oh, I have my life back.
It has been chosen by our armed services to be the primary treatment modality for our returning veterans to deal with PTSD and other trauma. It is also the #1 chosen treatment modality by the World Health Organization throughout the world to deal with traumatic events that happen across the globe. I believe that if a patient has looked into several different types of therapy or has done several different types of psychotherapy or other type of therapy, and it hasn't been as effective for them, then definitely consider EMDR.
Your body will heal itself most of the time. One of the things I love about the Amen Clinic and what Daniel Amen said is you're not stuck with the brain that you're born with. We know that now. The brain can rewire itself. It can make new connections, okay? So let's say I get a splinter. Probably my finger's just gonna work it out and life's gonna be good. Well, sometimes the splinter gets stuck. Well, EMDR is kind of like the tweezer, and it removes the splinter so that your body can heal naturally.